Hi, my name is Amanda Helwell, and this is my assessment discussion on nursing informatics. The first question is, how has nursing informatics, such as EHRs, telehealth, or clinical discussion support systems influenced the way you provide patient care? When I began my nursing career in 2015, I worked in a lot of rural areas where they were still using paper charting, or they were transitioning into electronic health records. So this really made me appreciate the difference between paper charting and EHRs, because the documentation was more convenient and efficient and allowed me to spend more time with my patients, providing focused patient care. It also helped reduce medication errors through built-in safety checks and made real-time charting possible, which improved communication and the continuity of patient care. The second question is, what benefits have you observed in terms of patient outcomes, communication, or workflow? In my experience, one of the greatest benefits of EHR technology is the improvement in communication among healthcare staff and in interdisciplinary teams. This is really effective, especially if you've been off for a couple of days. It really helps to fill in the gaps, being able to review patients' information, such as their last PRN medication dose or updated lab or imaging results. You can even look at physician's notes and any documented changes in the patient's condition, which sometimes can be left out during shift reports. So this level of accessibility and clarity supports safer care, enhances workflow efficiency, and ultimately contributes to better patient outcomes. The third question is, what challenges or barriers have you encountered when using technology in nursing practices? One of the most significant challenges I've ever encountered while working was actually with agency staff. I was at a facility that I wasn't really familiar with, but just so happened during medication pass right at 6 p.m. Or 8 p.m., the whole electronic health record system crashed, and it was like a nationwide crash. And the crash out was for about 4 hours. Because of this, it led to patients receiving their medications late, increased behaviors on the units because of it, and the situation was more difficult. What made it more difficult was the fact that we didn't have a backup of the Mars and TARS. Because of this, like I said, it caused for everything to run a lot later, and leaving staff without a reliable way to verify scheduled medications or document administration just really highlighted how vulnerable workflow can be when technology fails and proper contingencies plans are not in place. The fourth question, if you could recommend one improvement to the use of informatics in your workplace, what would it be and why? Especially for this situation when the whole EHR system crashed, I think that the best thing is maybe to do more, obviously have paper Mars and TARS as a backup, but also maybe even a backup EHR system to help carry out those times when there is outages. Also, doing system outages for periods of time, maybe at where they schedule them, so they can do any updates they need to do to prevent any of the crashes. Ensuring the availability of dependable backup resource would support continuity of care, reduce the risk of medication delays or omissions, and enhance overall patient safety. So yeah, thanks.